What's up, you guys? So if you have a foam roller at home or you see them at the gym and they're either collecting dust in your house or you have no idea what to do with it when you get to the gym, I'm going to show you a few ways to use a foam roller that I really like, either on your rest and recovery days or pre-workout, to help bring some blood flow to your muscles, loosen them up, relieve any tightness, tension, pain, soreness that you might have. So I'm gonna walk you through just a few ways to use it, kind of some bigger muscle groups or some big muscles that you're typically going to use during your lift or that typically get sore. So one way I like to use the foam roller is on your back, specifically your thoracic spine or your mid-back. So you're gonna start with the foam roller right below at the bottom of your rib cage. You don't want it to go too low where you're on your pelvis. So right at kind of the bottom of your rib cage, and then I have all my clients kind of rotate to one side so you're not directly on your spine. And then think about a small 2 to 3 inch area that you're rolling. So you don't want to roll the entire muscle group. You want to go in small little increments. So you're going to rotate a little bit, roll a couple inches up and down, and then move yourself down so the foam roller moves up. Roll a little bit more, move yourself down, foam roller moves up, rolling more kind of towards your upper back or right below your shoulder blade or scapula. And then you'll work your way back down, roll a couple times, roll a couple times, and then you can face the other way, do the same thing, working in small increments, rolling up, and then working your way back down. Reminder, you don't want to roll the entire muscle. You want to work in small increments. And then, so once you do your back, we're going to move to your hamstring. So same thing. Start with the foam roller right above your knee. Hands come behind you. Opposite knee is bent. You're putting that foot on the ground, bringing yourself up. So you're putting that pressure into your hamstring. Think about your hamstring in 3 different areas. So the bottom of your hamstring or right above your knee, you're going to roll there. Move yourself down. Foam roller moves up, hitting the middle of your hamstring. And then keep moving that foam roller up. Now we're kind of right below your glute at the top of your hamstring, rolling there, and then working your way back down. If you find a spot that feels extra tight, extra sore, you can spend a little bit more time there. But realistically, you don't need to spend more than 1, 2, 3 minutes max per muscle group. If you're spending 5-10 minutes rolling your hamstrings, you're not doing yourself a favor, you're kind of just wasting time. So a couple minutes on each muscle group, and then same thing, switch, do the other leg. Now moving on to quads, which is for most people a little bit more painful, but same way that we just rolled your hamstring. So you're gonna start with that foam roller right above your knee at the bottom of your quad. Now, you're on your forearm. I don't know if you can see from this angle. I'll show you on the other side too. But your opposite knee is bent and out to the side. So your foot is coming up off the ground. If this is way too much pressure in your quad, you can bring your toe back down and put more pressure onto your forearms to take pressure off of your quad. If you want that pressure, you can go a little bit lighter on your forearms, lighter on your opposite knee, toe off the ground to put all that pressure under your quad. And then same thing like we did with your hamstring, you're gonna roll yourself down, foam roller moves up. Right now I'm mid quad, rolling a couple times, and then I'm gonna push myself down even more. Now I'm more towards the top of my quad and hitting there. So back, hamstring, quad are 3 muscle groups I really like to do. I'll kind of show you what it looks like on the other side. So opposite knee is out to the side. So you're putting pressure into your knee, forearms, back toe. If you need it to take pressure off that quad, or you can kind of relieve some pressure off your other body part so more pressure goes onto your quad and you can roll it there. But same thing, you're working all the way up and then slowly all the way back down, avoiding rolling the whole muscle group. You want to go in those small little increments. All right, and we can also roll your glute. So in order to roll your glute, you want this foam roller to kind of sit right above your hip joint. That leg is gonna stay straight. Opposite knee is bent behind that leg. This arm can hang out wherever is comfortable. You're on your opposite forearm. And same thing, you were just finding small increments on your glute to roll. You wanna avoid rolling directly on any bony parts. So if you feel like you're on your pelvis, on your bone, kind of roll back or forward to get off of your bone and staying right on your muscle. You can work your way up, slowly work your way down. You can shift forward a little bit more to hit your IT band. You'd probably want to bring your back leg in front now. And now we're more directly on that IT band. And same thing, you can kind of work your way down that lateral quad, down onto your IT band until you get all the way to the bottom of that IT band, kind of by your knee, and you don't want to go much lower than your knee. This is a little painful, and then you got to work your way up. But remember, the more pressure that you put onto the ground, the more pressure you're taking off of the foam roller. So you can always adjust your pressure that way. We can also roll calves. So for calves, same thing, start at the bottom of your calf. Arms are behind you, knees bent, foot's flat, butt comes up, and we're rolling. I like to think of each muscle group in 3 areas. So bottom of your calf, we're rolling. Push yourself down. Mid calf, we're rolling. And kind of move back and forth, hitting that whole calf muscle. And then top of your calf, rolling here. Find where it feels tight, where it feels stiff, and then work your way back down. And then switch sides. So I hope you now have a little bit more clear of an idea of how to use your foam roller. So if it is in the corner of your living room collecting dust, you can now get it out. You can now use it. Like I said, I like to foam roll best on rest recovery days or pre-workout to bring some blood flow to your muscles, help to stretch everything out before you go into your lift. But of course, you can use it whenever. So I hope that helped. I hope that you are now going to start foam rolling before you lift.